Welcome to Nurses Sun Preparation Easy Learn Topics. Today's topic is types of antihypertensive medications. It's a very important topic. It is essential to know about these medications in our daily clinical practices. Important multiple choice questions in exams are asked from these topics as well. So please watch the full video to learn this topic. Types. First one is diuretics. Second, renin-angiotensin system inhibitors. Third, sympathetic inhibitors. 4, calcium channel blockers. And 5, vasodilators. First one, diuretics. Diuretics are also called water pills. It eliminates excess salt and water through urination, and this reduces the blood volume, and which in turn lowers the blood pressure. Types are thiazide diuretics, loop diuretics, and potassium sparing diuretics. Second one is renin-angiotensin system inhibitors. This blocks renin-angiotensin aldosterone system. The types are ACE inhibitors, angiotensin receptor blockers or ARBs, and direct renin inhibitors, DRIs. Third one is sympathetic inhibitors. Sympathetic inhibitors have two receptors, alpha receptor and beta receptor, which is on blood vessels and heart. The types are alpha adrenergic blockers. Second one is beta adrenergic blockers, and third one is alpha plus beta blockers, and the fourth one is central sympatholytics. Fourth type is calcium channel blockers. Calcium channel blockers block calcium from entering the muscle cells of the heart and blood vessels. This relaxes the blood vessels and reduces the heart rate. It is two types. The first one is dihydropyridines act primarily on the blood vessels. Examples are amlodipine and nifedipine. Second type is non-dihydropyridines. It acts on both the blood vessels and heart. Examples are diltiazem and verapamil. And the fifth one is vasodilators. Vasodilators. These medications directly relax the muscles in the blood vessel wall, causing them to widen and allowing blood to flow more easily. Two types. First one is arteriolar dilator. It relaxes and widens the arterioles. Examples, hydralazine, inositol, and felodipine. Second one is arterial plus venodilator. Act on both arteries and vein. Example, nitroprusside, captopril. Now, let us go to the topics in detail. Antihypertensives and its types. This chart you have to remember for your exams. All 5 categories of antihypertensive medicines and its subcategories are already mentioned in this chart, and go through the chart. Let us go to the topics in detail. The first type is diuretics. Diuretics are also known as water pills because diuretics helps the body eliminate excess salt and water through urination. This reduces blood volume, which in turn lowers the blood pressure. So, this is known as water pills. There are 3 types of diuretics. First one is thiazide diuretics. Second one, loop diuretics. And third one is potassium sparing diuretics. The first one is thiazide diuretics. These are often first-line treatment for high blood pressure. They also cause blood vessels to relax. Examples are hydrochlorothiazide and chlorthalidone. These examples, please remember for your exams, because most of the time this kind of questions can be asked from the examples of various categories of antihypertensive medicines. Next type is loop diuretics or high ceiling. Loop diuretics are also known as high ceiling because of its clinical peculiarities. These are more potent than thiazide diuretics and are typically used for patients with reduced kidney function or heart failure. Examples are furosemide or Lasix, which is one of the most commonly used medicine, and bumetanidine. These all are the examples of loop diuretics. And the third category is potassium sparing diuretics. These are weak diuretics that do not cause the body to lose potassium. They are sometimes used in combination with other diuretics to prevent low potassium levels. For example, a patient is with hypokalemia, we cannot use any normal diuretics which will again cause the decrease in potassium level. So here we will use potassium sparing diuretics. Examples are spironolactone, amiloride. Next category of antihypertensive medicines are renin-angiotensin system inhibitors. Now let us see the renin-angiotensin system to understand this medicine in a better way. Renin-angiotensin aldosterone system is a critical hormone cascade that regulates blood pressure, blood volume, and electrolyte balance. 3 steps you can see. First step, it is initiated by renin secretion from the kidneys in response to low blood pressure. When the blood pressure is low, the renin secretion is initiated by the kidneys. That is the first step. Then, it is leading to a series of enzymatic reactions that ultimately produce angiotensin II, a potent vasoconstrictor. So, after the renin secretion, it will trigger the angiotensin II release, which is a vasoconstrictor. Then after that, third step, angiotensin II then triggers the release of aldosterone, which causes sodium and water retention, further raising blood pressure and volume. This is the way our body maintains the homeostasis or maintaining the blood pressure by renin angiotensin aldosterone system. Here, renin angiotensin system inhibitors are in 3 types. ACE inhibitors, angiotensin converting enzyme inhibitors. Second one is angiotensin receptor blockers, ARBs. And third one is direct renin inhibitors. So 3 methods they will act. Some category will block the angiotensin converting enzyme. Some will act on the angiotensin receptor and some will directly act on renin. The first one is ACE inhibitors or angiotensin converting enzyme inhibitors. It will prevent the body from producing angiotensin II, a hormone that causes blood vessels to narrow. This allows blood vessels to relax and widen, lowering the blood pressure. This is the mechanism of ACE inhibitors. Examples are lisinopril, ramipril, enalapril. So the pril, you can have an interesting trick also here. Some of the categories will have the common ending. For example, this ACE inhibitors, most of the medicine have the end with pril. Lisinopril, ramipril, enalapril. There is an important note. A common side effect of this ACE inhibitors is a dry hacking cough. This also can be remembered for the exam. Then next category is angiotensin receptor blockers or ARBs. ARBs block the action of angiotensin II at its receptor, preventing the hormone from causing blood vessels to constrict. This keeps blood vessels relaxed and open. Examples: losartan, telmisartan, valsartan, etc. So here angiotensin receptor blockers or ARBs have the interesting end of tan. Losartan, telmisartan, valsartan. Previously AC it was pril and here it is tan. So this also you have to take for the memory tip to remember easily. Blockers are with tan and AC inhibitors with pril. And the third category is direct renin inhibitors or DRI. This newer class of drugs works by blocking renin, an enzyme that starts the process of producing angiotensin. Example, aliskiren. This example also you have to remember. This is the direct renin inhibitor. Now let us go to the next category, sympathetic inhibitors. Let us see the sympathetic alpha-beta receptors, how it is working for maintaining the blood pressure. Alpha and beta adrenergic receptors are the G protein coupled receptors that respond to the hormones epinephrine and norepinephrine, playing a crucial role in the body's fight or flight sympathetic nervous system response. Epinephrine or norepinephrine, otherwise adrenaline or noradrenaline. This is the hormones which plays a crucial role in fight or flight response for the sympathetic nervous system. So alpha receptors typically cause smooth muscle contraction and vasoconstriction. Here beta receptor increases heart rate, contractility and the release of renin and bronchodilation. So here alpha, you can see it is act on the vessels, blood vessels, and beta receptors act on the heart. You can simply say it like that. So the subcategories we can see, sympathetic inhibitors are 4 types: alpha blockers or alpha adrenergic blockers, beta blockers or beta adrenergic blockers, alpha plus beta blockers, and central sympatholytics. First type is alpha adrenergic blockers. These drugs reduce nerve impulses that causes blood vessels to narrow, relaxing the vascular walls. So it is acting basically on the blood vessels. So it will widen the blood vessels, so relaxing the vascular walls and reducing the blood pressure. Examples are doxazosine and prazosin. Next category is beta adrenergic blockers or beta blockers. Beta blockers reduce blood pressure by slowing the heart rate and force of the heart contraction. So beta blockers basically act on the heart. Alpha blockers act basically on the smooth muscles of or blood vessels. Here are beta blockers are acting on the heart. Examples are metoprolol, atenolol and propranolol. So beta blockers, you can see most of the drugs are ending with lol. So metoprolol, atenolol and propranolol are the examples of beta blockers. Now alpha plus beta blockers. Here this medication work by preventing adrenaline and other catecholamines from stimulating alpha and beta receptors in the body's autonomic nervous system. By blocking alpha receptor, vasodilation, and by blocking beta receptors, slows the heart rate and decrease the force with which the heart pumps. So both directions, in heart and in vessels also it will act. Examples are labetalol, carvedilol. Then the last category is central sympatholytics. These medications act on the brain to block signals that increases heart rate and narrow blood vessels. Examples are methyl-topa, clonidine. This will directly act on the brain. So you can see the categories. The first one was acting on the smooth muscles or blood vessels. Second one was acting on the heart. And here it is directly on the brain or sympathetic system. The medication act on brain to block signals that increase the heart rate and narrow blood vessels. Example, methyl-topa, clonidine. Then the fourth category of antihypertensive medicines is calcium channel blockers. Calcium channel blockers or CCBs block calcium from entering the muscle cells of the heart and blood vessels. This relaxes the blood vessels and reduces the heart rate. This is of 2 types: dihydropyridines that act primarily on the blood vessels, examples amlodipine, nifedipine, and non-dihydropyridines. This will act both the blood vessels and the heart, example diltiazem and verapamil. The final category of antihypertensive medicines is vasodilators. Vasodilators medications directly relax the muscles in the blood vessels wall, causing them to widen and allowing blood to flow more easily. These are 2 types: arteriolar dilator, a type of vasodilator that specifically relaxes and widens arterioles or small arteries, thereby reducing systemic vascular resistance and decrease the load on the heart. Examples are hydralazine, minoxidil, felodipine, etc. Here, second type is arteriolar plus venodilators, which will act on both arteries and veins. For example, nitroprusside, captopril. So, these are all about the antihypertensive medications. 5 main categories and its subcategories with examples. Please remember all these examples and mechanism for the better scoring in your exams, because important questions will be asked from this topic. We are winding up this session. Thank you for watching this video. Please add your valuable feedback and subscribe this channel for more exam preparation videos. Thank you so much.